Good afternoon. My name is Linda Gigliotti. Thank you for the opportunity to describe the impetus behind the development of the new interdisciplinary specialist certification in obesity and weight management as a forthcoming interdisciplinary credential. I will describe the other disciplines that are involved, but also walk through the certification process. As we all know, for too many years, obesity was considered to be a problem of consuming too much food. And therefore, treatment historically really was addressing dietary intake. If a person with obesity managed to get to a health professional, they might get to a dietitian. And the focus for many years for dietitians working with people with obesity was to do variations of diets or food intake and manipulating that in an effort to reduce calories. As we know, that did not address the problem. And I think these statistics that we have seen today on the rising rates of obesity were really the call for action for all of us as we began to understand that obesity was far more complex. So dietitians therefore sought more training, much like you've just seen with physician training. Stereotypical training for dietitians really didn't identify weight management as a niche or a specialty area. So dietitians sought additional training in order to become more skilled in working with clients with obesity. The Commission on Dietetic Registration, or CDR, responded in the early 2000s by beginning to provide some certificate of training programs, initially with adult management, followed by a special training program on childhood and adolescent weight management. And then, as it was realized that the field was continuing to grow, we were understanding more, it was more complex, an advanced level in adult weight management was added. These are very intensive training programs. Pre-readings required, 2.5 days of live presentations, followed by a one-time opportunity for a post-test to secure a certificate. Somewhere between 35 and 50 hours of continuing education are offered in completing this. And these certificate of training programs have been phenomenally popular with dietitians. Over 20,000 dietitians have completed these courses over the years, and they continue to be well attended with up to 6 different certificate training programs offered each calendar year. And yet dietitians were asking for more. Many people attending these certificate programs expressed the desire for a credential that spoke more to the expertise and gave credibility to dietitians who were working with people with obesity. At the same time, other disciplines in healthcare were recognizing the same need. You just heard about the obesity medicine credential. At about the same time, the American Society of Bariatric and Metabolic Surgery was developing the credential for bariatric nurses. So I think various healthcare professions were recognizing this need to speak to expertise and credibility. So the Commission on Dietetic Registration took the lead to develop a new credential, which is now called the Board Certified Specialist in Obesity and Weight Management. So who is this CDR? Well, CDR is the credentialing agency for the Academy of Nutrition and Dietetics. Currently, CDR administers 7 certification programs for registered dietitian nutritionists. And CDR believed that the certification would bring increased recognition and competency to the field of obesity and weight management by supporting this specialist credential. Let me use a timeline approach to talk a little bit about the process of developing a credential. In early 2013, the Weight Management Dietetic Practice Group, in conjunction with the Diabetes and Care and Education Practice Group, petitioned the Council of Future Practice to consider a new credential. The Council of Future Practice within the Academy of Nutrition and Dietetics is the organization that is charged with, among other things, to look at new specialist certifications, looking ahead at where our profession is going. In several months later then, the Council on Future Practice supported and authorized moving ahead with this new specialist credential. But before the Commission on Dietetic Registration could actually begin working on this, there were several groups within the Academy that said, but wait, this has been approved as a credential for dietitians, but is this really what we want? Would we be better served, would the public be better served with a credential that was interdisciplinary instead? So it was back to the drawing board thinking about that, after some considerations and study, it was decided to move forward with the development of an interdisciplinary board-certified specialist in obesity and weight management as a certification program. Why did CDR make that decision to develop this new interdisciplinary credential? I do want to make sure we are all in the same wavelength when we're talking interdisciplinary. We're referring to a group of healthcare professionals, but from diverse fields, but working in a coordinated fashion toward a common goal for the patient. It's an approach characterized by a high degree of collaboration and communication. There were several considerations going into the decision to make this an interdisciplinary specialist certification, beyond the fact that it meets CDR's mission to administer credentialing processes to protect the public. As we have heard loud and clear today, and certainly this audience knows, obesity is a multifactorial disease. It requires more than nutrition interventions. That's just part of it. We need interdisciplinary solutions. Even if it could be addressed simply from nutrition, the dietetic profession's capacity could not meet the needs. There is only one dietitian for about every 8,000 US residents. And we know that there are other interdisciplinary credentials, such as the Certified Diabetes Educator, Certified Nutrition Support Clinician, that are valued and well respected in the marketplace. So the conclusion was that both the public as well as healthcare professionals would be best served with an interdisciplinary credential. So who was to be included? What other disciplines were to be included? Well, a task force reviewed the licensure and certification requirements of several allied health professional groups to determine the degree to which they were actually involved in weight management and obesity treatment, as well as their interest in pursuing a specialist certification in this area. And the recommendation was to include those professions that you see listed on the screen, in addition to registered dietitian nutritionists, physician assistants, nurse practitioners, clinical exercise physiologists, licensed behavioral psychologist or therapist, and a licensed clinical social worker. The certification process is rather lengthy, has multiple steps, and this graphic does help to outline some of the steps. The first step is beginning with a practice analysis, which is a survey of the practice, in our case, of obesity and weight management. This is actually required by the credentialing body, the National Commission for Certifying Agencies. And a practice analysis really assists in ensuring that the certification is job-related, representative of practice, and geared towards various responsibility levels. And after going through the practice level, a practice audit then, there were subject matter experts from each of the disciplines involved who contributed then to item development, review of those items, and task form development. That process took a little over a year. The content outline then came out of the practice analysis. You see a breakdown here of the content outline, about 28% related to patient assessment and development of the treatment plan, 48% intervention and treatment, and then the remainder being monitoring and evaluation. And this is the distribution of content on the exam as well, with 125 items. The eligibility for the exam as a result of the practice analysis was identified for those healthcare professionals you see listed on the screen and were mentioned earlier. In addition to having a certificate or certification credential rather in their own area, the individual did need to have practiced for at least 2 years and document 2,000 hours of practice for the exam. And that brings us to where we are today. The first exam period just concluded a couple of weeks ago on March 24th. We are now moving on to the cut score. So when I leave here, I will be flying to Chicago, where this weekend we will be meeting with our test vendor to go through the item analysis and the cut score. From there, we will identify the score report and then program evaluation. The next step is to continue to evaluate. A second exam period is scheduled for September. We will repeat the practice analysis no later than the year 2020, possibly earlier, and at that time may consider other professions. We'll evaluate those professions that are included. So this is definitely a work in progress. Thank you very much.